All right, welcome to The Explainer. Today, we're diving into something called keratoconus. It's a really fascinating eye condition that can, really mess with your vision. But the good news is we're also going to talk about two incredible procedures, C3R and CAIRS, that are honestly changing the game when it comes to treatment.
So, let me ask you something. Have you ever been reading and seen like a faint ghost image right next to the letters? Or maybe when you're driving at night, headlights aren't just lights, they're big starbursts with streaks coming off them. If any of that sounds familiar, or maybe you're getting double vision but only in one eye, well, it could be a sign that the very front of your eye, think of it like a windshield, is starting to change its shape.
And yeah, that windshield I just mentioned, that's your cornea. Normally, it's this perfectly smooth, round dome. But with keratoconus, something happens. It starts to thin out, and it literally begins to bulge forward, forming this cone-like shape. And because it's not a perfect dome anymore, light doesn't focus correctly. And that's exactly where all that weird, distorted vision comes from. So the big question is, what causes this to happen? Well, genetics can play a role, and so can allergies, for sure. But here's the kicker. The single biggest trigger, and this is the one you can actually do something about, is just chronic, aggressive eye rubbing. It sounds so simple, right? But that constant physical pressure can literally weaken and break down the structure of your cornea over time, basically paving the way for the disease to take hold. And that genetic link, it is absolutely real. Think about this. For about 1 out of every 10 people who has keratoconus, they've got a close family member who has it too. So what does that tell us? It suggests that some people might just be born with a cornea that's a little bit weaker to begin with. Which means, if this runs in your family, you gotta be extra vigilant about those symptoms we talked about. Okay, so here's our roadmap for today. We'll start with what keratoconus is, then jump into a really smart two-pronged solution. We'll break down CCR, which strengthens the cornea, and then CAIRS, which reshapes it. After that, we'll talk about treatment and recovery, and finally, what life is like after the procedure. Let's get into it.
Right, so when we talk about modern treatment, it's not about just one magic bullet. It's really this smart, two-pronged attack on the problem. First things first, you've got to stabilize the cornea and stop the disease from getting any worse. That's job number 1. Then, part 2 is to actually go in and reshape the cornea to improve the vision you've got.
And this is probably the best way to think about it. Imagine C3R is like adding a super strong glue to the cornea, making the whole structure stronger and more rigid. Then you have CAIRS, which is like installing tiny invisible support beams inside the cornea to physically push that bulge back out and reshape it. Glue and support beams. Simple, right? This chart really lays it all out beautifully. You can see how these two procedures have totally different, but, perfectly complementary jobs. C3R is all about stopping the disease. It uses riboflavin, which is just vitamin B2, and some UV light to basically freeze the condition in place. Then you have CAIRS, which is this newer, really cool innovation. It uses actual human donor tissue to go in and reshape the cornea to make you see better. So one stops the progression, the other improves the vision. All right, let's zoom in on the first part of our solution, C3R. This is all about strengthening the cornea. Its goal is super simple and super important. Halt the progression of the disease. This procedure is often called the Dresden protocol for where it was developed, and its whole job is to make that cornea tough and rigid. So how does it work? Well, it's actually a pretty elegant process. First, they'll numb your eye with some drops so you don't feel a thing. Then, they soak the cornea with riboflavin drops. Again, that's just a special form of vitamin B2. After about 20 or 30 minutes of that, they bring in a very specific UV light. And this is the magic part. The light activates the vitamin, which then creates all these new, strong crosslinks between the collagen fibers in your cornea. It's like re-welding the internal structure to make it solid again. Okay, so once the cornea is strengthened with C3R, how do we fix the shape? That's where CAIRS comes in. This is the part of the treatment that's all about reshaping the cornea, and it uses a truly natural alternative to the older methods that use plastic. And this is really the game-changing part of CAIRS. See, the older way of doing this involved implanting tiny plastic rings into the cornea. And, well, sometimes the body didn't love having plastic in there. It could lead to complications. The big innovation with CAIRS is that instead of plastic, it uses tiny segments of natural donated human corneal tissue. Your body sees it as its own, so it just accepts it much, much more easily. The way they do this is just incredible. It's super high-tech. First, an ultra-precise laser creates these tiny little tunnels, or channels, inside the middle layer of your cornea. The surgeon then takes the donor tissue, shapes it into these perfect little arcs, and then gently slides them right into those laser-made tunnels. Once they're in place, they act like a new internal framework, a scaffold, that pushes up from the inside and flattens out that cone shape. And this whole technique was pioneered by Dr. Susan Jacob. It really came from a brilliant, common-sense question. How can we get that same amazing vision reshaping effect that the old plastic rings gave us, but do it in a way that avoids all the potential problems of putting something synthetic and foreign inside the eye? The answer, it turns out, was to use natural tissue. Okay, so we've talked about the how, but what's it actually like to go through this? What's the path to getting that clearer, more stable vision? Let's walk through what you can expect during the treatment and recovery phase. The prep work before the procedure is actually pretty straightforward. The main thing, and it's really important, is that you have to take what they call a contact lens holiday. That means no soft contacts for about a week before, and no hard lenses for maybe 2 or 3 weeks. And the reason is simple. Contacts can actually change the shape of your cornea slightly. And for this to work, your surgeon needs a perfect, unaltered map of your eye to plan everything out. Now, after the procedure, this is basically your rule book for a smooth recovery. And listen up, because the number one, most important, absolutely critical rule is this. Do not rub your eyes. Seriously, any rubbing at all can mess up the healing process. Of course, the other things are important too, like keeping tap water out of your eye and no swimming for a bit to avoid any chance of infection. But not rubbing, that's the big one. It's really important to note that healing doesn't happen overnight. It's a gradual journey. For the first couple of days, your eye might feel a little gritty, and you'll probably be sensitive to light. That's normal. After 3 to 5 days, your doctor takes off the special bandage contact lens. Your vision might still be a bit blurry for a while, but you just have to be patient. It takes about 3 to 6 months for everything to fully stabilize and for you to see that final amazing result. So you've gone through the procedure, you've done the recovery. What now? What does life look like on the other side? Let's talk about the new horizon for your vision. Okay, this is probably the most crucial thing to understand just to manage expectations. The main goal here is not to get you to throw away your glasses or contacts. The primary, number one, most important objective is to stabilize the eye. It's about stopping this disease in its tracks so you don't need a full-blown corneal transplant down the road. That's the real win. But the benefits? Oh man, they are absolutely life-changing. First, you halt the progression of keratoconus. That alone is huge. That means you likely avoid a major corneal transplant later on. But here's the other amazing part. By making the cornea's shape more regular, your glasses and contacts just work better. The prescription can finally do its job properly, which often means your vision is way sharper than it was before. It's both preventative and restorative. So all of this success, especially with a technique like CAIRS, really makes you wonder, right? It leaves us with this really fascinating question for the future. For so long, we thought the answer was always high-tech plastics and synthetic materials. But what if the real future of vision correction is this incredible blend, combining our most advanced technology, like these precision lasers, with something perfectly natural, the body's own tissue? It's a powerful idea to think about.